As noted in a previous video, the coronavirus definitely raises to the surface mass inequalities in American society. We've talked about matters like lack of healthcare coverage, lack of adequate internet access, and so on and so forth. The list is really long and we could keep going. Today I want to talk about underprivileged groups within underprivileged groups, if I can call it that. The focus today is how the coronavirus is impacting human beings behind bars or in prisons. The American criminal justice system holds almost 2.3 million people in over 1,800 state prisons, 110 federal prisons, over 1,700 juvenile correction facilities, over 3,000 local jails, over 200 immigration detention facilities, and an additional 80 Indian country jails, as well as military prisons like Guantanamo Bay, detention centers, state psychiatric hospitals, and various other forms of prisons. This is a vast and complex network of oppression. According to a 2018 report from the Bureau of Justice Statistics, nearly 2.2 million adults were held in America's prisons and jails at the end of 2016. That number has surely gone up. That means for every 100,000 people residing in the United States, approximately 655 of them were behind bars. If the U.S. prison population were a city, it would be among the country's 10 largest. Let me repeat that. If the U.S. prison population were a city, it would be among the 10 largest in the United States. In fact, it would be larger than Philadelphia and Dallas. According to the Sentencing Project, the Bureau of Justice Statistics reports that 35% of state prisoners are white, 38% are black, and 21% are Hispanic. In 12 states, more than half of the prison population is African American. Now, what does that mean in light of the coronavirus pandemic? Well, let's put it this way. Prisons are quite literally petri dishes for the spread of something like the coronavirus. Unfortunately, we know that prisons and jails are virus vectors. And even employees who live and work within these, quote, institutions are sitting ducks for the virus itself. Think about it. Prisoners sleep, eat, interact, mingle, all within the closed quarters of a given prison with limited ventilation. Social distancing is impossible. Prison populations also have greater rates of serious health problems than the general population, as the ACLU National Prison Project notes. Some are elderly and have diabetes or cardiovascular disease or asthma and cancer, all of which are conditions that the coronavirus undoubtedly worsens. Some advocates, as NBC News recently reported in an online article, are calling for large-scale prison releases to knock back the threat of the coronavirus. Across the United States, local and state officials have begun freeing low-level and non-violent offenders, among them migrants, the elderly, the infirm, and those with short remaining sentences, to avoid an outbreak that the ACLU warned would spread quickly and devastatingly. So I suppose that is some good news. We have national organizations working on behalf of the human rights of individuals within prisons. But then another article that really caught my eye, written by The Intercept, just brought my mind to a completely different direction. The Intercept reported that New York City is offering prisoners at Rikers Island $6 per hour, which is really a fortune by prison labor standards, to dig mass graves on Hart Island, according to sources with knowledge of the offer. Avery Cohen, a spokesperson for the office of Mayor Bill de Blasio, confirmed the general arrangement, but said that it was not COVID specific, noting that prisoners have been digging graves on Hart Island for years. The offer is only being made to those with convictions, not those jailed before trial. A memo sent to prisoners, according to a source who reviewed it, does not specify what the work on Hart Island will be. New York City owns and operates this public cemetery on Hart Island, which has long been kept by prison labor. The island was identified as a potential resting place for a surge of bodies in the event of a pandemic by a 2008 report put together by the New York City Office of Chief Medical Examiner. This is a bit disheartening news on many fronts. The abuse of prisoners, the seemingly lack of care and humanity for our fellow human beings. So some questions for you to consider today in light of the statistics that were offered at the beginning of this video and the work that the ACLU is doing to bring to light some potential prison labor abuses on Rikers Island. The first question, are you able to empathize with the prisoners who are locked up at this moment during this time of pandemic? Question number 2, prisoners are one of the many forgotten, quote, microgroups that could face dire consequences because of this coronavirus. What other groups come to mind in light of this idea of a minority within a minority? And what can we do to assist these hypothetical groups? And third, and this question may involve a bit more research, does the US prison system need to be changed? If so, why and how? Those are some pretty loaded questions. Feel free to answer them in any manner that you deem fit. You can take it in this direction or that direction. It's really up to you. They're designed to be flexible and they're designed to be loose. I hope you're enjoying these videos, even though most of them are focusing on the coronavirus. These are unprecedented times, and I think it's really important for us to take some of the things that we see in the media and apply it to sociological thinking, sociological reasoning, and most importantly, sociological solutions to some of the main social problems that are coming out of this pandemic. Stay safe, everyone. Thank you.